The very first thing to do is to reduce your salt intake. You see, when you've got too much salt in your body, you retain water. If you've got too much water in your blood vessels, this exerts a pressure on the blood vessel wall. This in turn, unsurprisingly, increases your blood pressure. So the key for this one, reduce your salt intake. But it's not that simple. You see, that's the maximum amount of salt you can have in a day. And that is 6 grams of salt. But in the developed world, we have far too much salt in our diet. Actually, it's more around 8 grams. The key to this one, which I'll let you in on a little secret. A lot of people think it's about the salt in the shakers. So they say, I'm going to put less salt in my cooking, or I'm going to change how I cook. But the secret is 75% of our salt comes from our processed food diet. So things we buy in the supermarket, things that we're consuming without even knowing the salt content of. This is the real key to changing your diet. Focus more on reading labels, making sure you're getting low salt things, and this can make a huge difference in your diet. And importantly, to take control of your salt intake, it means less takeaway foods, less Deliveroo's, Uber Eats, and less going out, but also getting back into the kitchen, cooking your own meals with fresh vegetables so that you know how much salt is in there. And some tips for reducing salt intake: swap the salt for other condiments. Use rosemary, use oregano, use dill, use herbs and spices instead of salt. But be careful, some shakers that are, they have mixed herbs and spices do also contain salt, just to mess with you a little bit there. The next one is weight loss. For a lot of us over this pandemic period, we've had busier jobs, we've had less time to exercise, and generally we've probably gained a bit of weight. The key here is we need to shift back and take control of our day-to-day life. We are living more sedentary lifestyles. We're not moving around as much. We're maybe eating more calorie high foods as well. Key here is to try and do more exercise, try and get your body moving, but also try and shift some of that weight, because that will also help lower your blood pressure. Research has shown that people who exercise, their heart muscles can pump the blood more efficiently, and this efficient pump can also reduce your blood pressure. So the key for this one is to exercise regularly. Generally, it's said that 150 minutes of exercise in a week, and it needs to be moderate intensity. So we're talking about cycling, running, brisk walking, rowing, or anything that gets you a little bit out of breath is going to be important. You can break it up into 3 or 4 days a week. And the other beautiful thing about exercise is you're expending calories, so it will also help you lose weight, which is another bonus for lowering your blood pressure. Also focus on what you're eating. It's too simplistic to just say cut out all salt and don't worry about the rest of your diet. Aim for more like a Mediterranean diet. So lots of fruit and vegetables, legumes, seeds, nuts. Use extra virgin olive oil for your cooking, and just aim to be more healthy. Avoid deep fried foods, fatty foods, or foods high in saturates. So things like sausages, hot dogs. Again, it's coming back down to processed foods. If you aim to reduce these and replace them more with fruit and vegetables, like aiming to get 5 fruit and vegetable a day, you will shift your diet to a much healthier type of diet. And again, this will help you lose weight and improve your blood pressure. So when you're stressed, your body releases these fight or flight hormones, your cortisol, your adrenaline. And back in the day, and I mean like way back in the day, they used to get you ready to fight for your life or to run and get the hell out of the situation. But they've been replaced by deadlines, morning traffic, and other stressful life events. But your body doesn't know the difference. Your body still thinks it's in a fight or flight situation, which means it's constantly ready. It's pushing your blood pressure up, it's increasing your heart rate, getting you ready to run basically. And a constant state of stress is not healthy for you. That's why reducing your stress levels can make such an important impact on your blood pressure, but also around a lot of other aspects of your health too. So what do we do to reduce our stress levels? Well, we can't just hide in a room and hope that everything settles down and then when it's all chill and quiet, we'll come out. But instead, we have to use day-to-day tools and techniques that can help calm us down a little bit more. The very first one of those is meditation and mindfulness. If you do meditation and mindfulness every single day, It helps kick in a part of our nervous system that is related with relaxation, related with lowering your blood pressure. We'll talk about that in another video where we do some deep breathing exercises, which can actually lower your blood pressure. But if you do these on a day-to-day basis, your stress levels can come down. And we talk about exercise. Again, when you're exercising, you're releasing awesome chemicals in the brain. That's the scientific term for it, yes. And what that does is it just relaxes your body. Same for other things. If you're doing things you enjoy, whether it's painting, whether it's video games or other hobbies, you're in a state of relaxation. Your body's enjoying that, and that's good, because it takes you away from that anxiety and that discomfort. Aim to be more in those good situations. Aim to do those healthy things that can get your blood pressure down. The next couple are self-explanatory. The first one is to limit your alcohol intake. Healthy alcohol intake for adults, male and female in the UK, is at 14 units. And generally it's said that you should spread that out over 3 days or more. And you should also have some days where you're not drinking anything at all to give your liver a bit of a chill out session. So let's look at it. A medium glass of wine is 2 units. A large glass of wine, if I remember correctly, is 3 units. A pint of beer or lager, it's going to be between 2 or 3 units. So keep a close eye on your alcohol intake, because sometimes it's going to be a gradual increase, and that's when we start to fall into unhealthy habits. Next one is to reduce your caffeine intake. So you get caffeine in chocolate, teas, coffees, and also fizzy drinks like your sodas, but also those crazy energy drinks that teenagers are drinking all the time nowadays. If you're drinking too much caffeine, it can do constriction of your blood vessels, which means it gets narrower. And if you think about it, if you make something narrower, the pressure inside increases, and that's never good. While the odd tea and coffee isn't going to be a problem, it's about having it in moderation. Switch to decaf if you wanted to, or stick to 1 or 2 a day maximum. If you're really serious about lowering your blood pressure and you're smoking, I would say this is probably going to be the most important one. You have to stop smoking. Smoking damages your blood vessels, also pushes your blood pressure up, and it's almost a double effect, as well as a whole host of other conditions it can cause, including cancer. I can't really emphasize how important it is. I would really say have a chat with your family doctor. They can give you alternatives, whether it's nicotine patches or medications that can help you stop. But really important, if we're going to make huge changes to our lifestyle, smoking is going to be one of the most important ones. So now we're on to the most important question. Should you go down the route of lifestyle factors, or do you go for tablets for high blood pressure? I think it should never be a question of one or the other. I think always the most important thing is going to be your lifestyle factors for pretty much all conditions. I think sometimes modern medicine is too simplistic. We see a problem, we don't have that much time to deal with it. We paste the medication on top and we say goodbye, good luck with that. You see, in the UK, family doctors get 10 minutes in a consultation. 2 or 3 of those minutes are to write medico-legally strong notes to defend and protect you. So that means you really have 7 minutes to describe all these things I've described to you today, and also have an informed discussion with your patient. It's pretty much impossible. This is what I would say to my patients. If we don't change our lifestyle, then it's a slippery slope. And what I would not like to happen is for people to be stuck on one medication, then another, and then it just increases, when we can identify things that we can change that can make you healthier. And if this has been an opportunity to get you healthier, then let's take that. But the caveat to that is that there are certain situations where the blood pressure is just too high. Say, if the blood pressure is over 160 over 100, and don't worry if you don't know what those numbers mean, the video at the end of this video will explain all of the numbers so you have a good idea what's going on. And what I would say to them is, look, lifestyle factors are so important. Please bring them into effect and work on them. But at the moment, your blood pressure is too high for me to be comfortable to send you home without protecting you more. Here are some medications to protect your heart, your blood vessels, whilst we work on the lifestyle factors. And that's key. It's not a case of this is a tablet, you don't have to do anything. It's a case of please work on those things, but here is something in addition to protect you. And as always, I always go through all the side effects of medications. And I also think hope is important, because it's not a one-way street. If somebody gets really good control of their lifestyle and they make huge changes and their blood pressure really improves, they may one day come off of those tablets. They may be able to control it themselves. And that is also key. To be able to empower somebody to make lifestyle changes and one day take them off medications and is for me one of the most rewarding things as a doctor. At the moment, I'm working on a free ebook on blood pressure and how to treat it at home, as well as the latest studies on there. So I'm still a couple of months away from it, but if you wanted that, you'll find it on my blog. That's drkhaled.com. I'll check in the comments to help you reach that goal. Please like and share this if you found it useful. I'll see you on next week's video.